Well, thanks for staying with us here on Sunrise. Back pain and headaches are common combination pain symptoms which may be related or independent of one another. Research shows that this particular duo of misery can be caused by one or more physical reasons, a psychological reason or a combination of two factors working in unison. To get more clarity on this, we are joined by the medical director of the Headache Clinic, Dr. Elliot Shevel. Doc, thank you so much for joining us this morning.
Good morning. Thank you.
Well, we want to let you know that you can ask the doctor any question you want. You can call us on 011-447-1742 or 1620. Now, Doc, let's start there. Is there a link between back pain and headaches?
There's very, very often a link. You know, as you mentioned, back pain can be caused by many things. But what I'd like to just explain to the listeners is the way the human body is built. You know, it's a long, straight pole.
Okay.
And it's held upright by means of muscles. Now, anything throwing the balance of the muscles out, either from side to side or from front to back, can cause an imbalance. And that can lead to a chain of events that can stretch up and down the body. For instance, if the one leg is a tiny bit shorter than the other, it causes an imbalance that can go all the way up. Okay. But it can also start at the other end. It can start at the head and neck area, which are very, very complex areas. Anything throwing the balance out can spread. It often spreads to the neck and often spreads to the back.
So it's a question of balance. It's literally, so headaches and that kind of thing is caused generally by an imbalance within the body.
One of the causes is muscle tension.
Okay.
And that's what causes most back pain as well.
Yeah.
And the muscles that actually attach to the skull from the shoulders go down the back as well. So there's this continuity of muscles that work together. And when we think of backwards and forwards, the head isn't balanced properly on the spinal column.
Yeah.
When you fall asleep, your head falls down. So it's got to be held there by the muscles at the back and the muscles at the front, pulling together. If the one pulls too much, the other's got to pull as well.
Yeah.
So there's a fine balance.
Fine balance there. So if someone has a back injury, would that cause severe headaches?
It can possibly cause severe headaches, and the other way around.
Okay. So a head injury could cause back pain then?
Correct.
Wow, okay, that's really awesome. So in terms of stress, does that cause a combination of the pains as well?
Well, what happens with stress? You know, stress is an emotion. It's not a painful emotion. When I get stressed, but I don't get pain. But if you are somebody who's got some muscle tension for whatever cause, when you're stressed, the muscles tense up more. So it can push it from muscle tension that's not painful over the threshold to muscle tension that is painful. So that is the most likely reason that stress causes headaches and can make back pain worse.
Okay, so if it's a physical pain, how does one treat that? Do you treat the headache or do you treat actually where the origin of the pain, if it's something like an accident or whatever the case may be?
Well, it just depends where the origin of the pain is, where one has to diagnose. For instance, I'm from the Headache Clinic, we treat headaches. So if it's coming from the head and neck area, then there might well be an improvement in the back pain.
Okay.
If it's a back injury, this is out of my field, you know, then you have to see an orthopedic surgeon or a chiropractor, or if it's a leg so it depends where the original injury is. But for instance, let me give you an example. Whiplash is a common injury.
Yeah.
Most whiplash injuries, the bones and the tendons and the discs are not involved. It's a muscle thing. When the head is jolted, a muscle gets pulled, and that spreads to the other muscles, and it can carry on long after the initial injury is healed. So we've got to make sure, and this is what we do at the Headache Clinic, we make sure that we relax the jaw and neck muscles without the use of medication.
Wow, that's awesome. We've got a question on Facebook, Ngauke, asking if a person does not drink enough water, can that cause a headache? And if a person does not rest enough, will that cause back pain?
The first question, some people, when they get dehydrated, it's a trigger for headaches. Other people can get dehydrated.
Because
they
very
don't
often
get.
you hear people say, like when someone says, I've got a headache, someone will say, just drink some water.
Sure, and if it works for you, that's fine. Unfortunately, it's not that simple. It doesn't work for everybody.
Yeah.
So we're all different. We all have different triggers, etc. And what I need the listeners also to know is that triggers are not where the pain comes from. For instance, somebody will be dehydrated, that will trigger it. Somebody else will have a hormone problem, that triggers it. Somebody else eats chocolate. The trigger is just the thing that sets it off.
Yeah.
The underlying problem is what we have to diagnose.
Okay. Okay. And then we got a call on the line. We'll get to the second question in a second. We got Calvin from Johannesburg. Good morning.
Morning, how are you?
Very well. How are you doing?
Good. I wanted to ask the doc something. Doc, sometimes it's just that I do get this sometimes, but I did went to some GP, but they said there was nothing with me. You find that your back is heating, but you're not necessarily sweating, you see, but your back is heating. When you try to lean maybe on a couch or on a bed, you find that your back is heating. What causes that, doc?
You know, I must be honest, I'm not a back doctor. I can only talk about the relationship between head pain and back pain. So this gentleman needs to find somebody that's an expert on backs.
So obviously, Calvin, you did see somebody about it. Did they give you an answer, though? Okay, we seem to have lost Calvin there. Doc, I have to ask you now, in terms of with the relationship between the head and the back, like you're saying, a muscle injury is the same as a hamstring, pulling a quad muscle. So treating the muscles, what's the first recourse you can take?
Well, we use a number of different methods to get the muscles to relax. The one that we very often use is called a posture modifying appliance because it corrects your posture. And once your posture is correct, your muscles can relax. That posture modifying appliance is something that's worn in the palate, and it's very, very comfortable. You don't even know it's there. And we get wonderful results relaxing the muscles. And some people, even their back pain improves, even though it's something in the mouth.
Okay, so one question we'll also add is, if someone has a recurrent migraine for some time and after an accident they develop tension headaches, how does one treat that?
Well, one has to find out where's the pain coming from. And in headaches and migraine, there are two main places where the pain comes from. The one is the muscles of the jaws and neck, and the other one is there are very small blood vessels in the skin that sometimes cause the pain. So this is where the diagnosis of migraine is very difficult. We've got to diagnose where the pain is coming from, and most doctors are not trained to do that, unfortunately.
Unfortunately. So I know that you said that there is a number that people can call if they have any issues whatsoever.
Yes, look, we have specially trained consultants that can answer a lot of questions, that are very knowledgeable about headaches. People are welcome to phone at no cost, at no obligation. We are passionate about trying to help people to get rid of their headaches. And if we can help them with a simple phone call, it will be our pleasure.
Okay, so that number is 011-484-0933, or they can go onto the website, that is theheadacheclinic.net, www.theheadacheclinic.net. So that's where they can get all the help they need.
Sure.
Well, definitely. Thank you so much for your time, Doc. We really appreciate it. That was Dr. Elliot Shevel talking to us about the combination of back pain and headaches. For more information, as I said, you can visit that website, theheadacheclinic.net.